Kathy's going to start recording. Okay, thank you. It's 3 o'clock and we're all here, all the committee members. So I am calling this August 9th meeting of the Budget, Capital, and Personnel Committee to order. And we have lots of minutes. Does anybody have any concerns about any of the minutes? If not, we can do them all three at the same time. Martha, did you have something? No? Okay. Oh, you're moving 3. Okay. Martha moves, Rich seconds. Any discussion? All in favor? Right? Okay, that's unanimous. Changes to the changes to the agenda that we have some modified revised resolutions. We also have an additional resolution implementing New York State Governor's recommendation that all county employees be vaccinated against COVID-19 or get tested weekly. Kathy, do we have to vote to add this?
Yes, probably should.
All right, can someone move that? That would be Rich moving, Glenn seconding. All in favor of adding it to the agenda? Mike? Okay, that's it. All right, I think what we will do is add that after Ruby's report. And I see no members of the public present in the chamber today. Kathy, is there anybody? Okay, so we have no public comments. So, Lisa, you're up.
Thank you, Barbara. My report today will be brief. I think prior to convening, I was able to introduce you all to our new budget director, Dan Nolan, who's joining us today in person. This is, I think, his 3rd week on the job, and we've been working steadily along with the county budget and consulting quite frequently with Kevin and from time to time with Jason as well. So that's been helpful. We're making good progress. Our budget analyst, Samantha Freilich, began today as well. Today's her first day on the job, and she went through orientation today. We're glad to have her joining us. We completed our 3 weeks of meetings with county departments and agencies regarding their budget requests, and are now working to assemble them. And I wanted to just bring to everyone's attention, just given the timeline that we're on and the change in personnel, I think it is most for us to anticipate needing an extra to complete the budget this year. So I made that, I made leadership aware of that, and Kathy aware of that in terms of the budget calendar. I just think it come up with the best outcome and product for everyone to consider, that we should plan on that in the calendar. And then I have some resolutions for consideration further on in the agenda, but those are my updates.
Okay, thank you. Does anybody have questions? Martha?
Yeah, so I'm looking at the calendar. I guess usually the administrator presents the budget at the first legislature meeting on the 7th. We have an expanded budget meeting 2 days later. Are you suggesting that we cancel that meeting, or?
Yeah, I discussed it with Kathy this morning, and thought that if I were able to present the budget on the 15th, there's a ABC meeting then, and then consider adding canceling the 9th ABC meeting and adding another meeting perhaps in October, We had some days blocked off for the possibility of the ICMA conference, which is in person in Portland, and I don't think any of us intend to travel this fall, given what's happening with the virus. So I think October 4th is a possibility.
Yes.
So if I can ask the EBC, because they're all scheduled for 4:30. Right?
Except for the one on the 9th, which were canceled. And also the one on the 14th, because people have to travel back to Syracuse.
Oh, what time is that supposed to be?
That one's 5:30, sorry, I don't know. The
That's
all
the 14th at 4:30.
At 4:30 as well? Oh, okay.
That's what I had. I mean, I would, I'm going to the NISAC conference and I was thinking of maybe just watching from the hotel room or something. 5:30 would help that instead of 4:30. Make that adjustment.
Well, it's up to Kathy. I mean, I would prefer to have it at 5:30 only because several of us are going to be coming back from Syracuse that day. And it would be less of a time crunch.
Well, let's propose the 14th at 5:30 and then October 4th at 4:30.
That works. We'll just have to make that work, Kathy. It's, you know, because this is something we have to get done. Does anybody have anything else? Rich? Oh, Mike, you put your hand up. I'm sorry.
Oh, I thought you meant about schedule.
Well, do you have something about the schedule, Rich?
I was just going to say this seems entirely reasonable. Lisa, it's totally understandable. You need extra week. No problem.
I agree. Okay, Mike?
I was just wondering, Lisa, how are your OP requests coming in? From previous years, you think a lot more. Okay.
I would say, we're in the process of compiling them to get to the bottom line, but I think there are more than previous years. There's certainly some restoration of positions that we're considering and restoration of cut from agency. Yeah, not necessarily one-to-one restoration, but restructuring and therefore the need for additional staffing. So yes.
Thank you. Good question, Mike. Okay, is that it for now? Okay, thank you. And we have Drew available online to give the Director of Finance report. Hi, Drew.
Hello there. Good afternoon. I'm just going to share one quick screen with you. Going over the contingency account. I know that Deborah did email folks over the weekend with some more updated numbers. These are the numbers that were actually approved so far. So the contingency fund started at 1.9 million. You can see the multiple requests so far, totaling 1.4 million coming out. So it leaves us a balance of 470,000. And I know that there are some further ones. So that was all I had coming from Rick today. Any questions?
Any questions? Martha?
Yeah, we couldn't see that. You said right now, 470,000 is still in the fund. You don't have anything, not counting what's pending in front of us today, right?
Correct. Correct.
Okay, and there was a confusion. Deborah sent a note saying that we had earlier passed the budget resolution that reduced our fund balance by 325,000, and Rick had commented that was for the 2020 budget.
Correct.
So that subtraction is already figured into
The audited final for 20.
right. Okay, so that's not an issue. Okay. And if we have a need, if there's something, well, let me just ask, in your experience, your sense, do you think we will have a lot more than what we have now? I mean, do you foresee a lot of additional requests for the rest of the year? If any way to know?
Well, there's really no way to know, but I do hear some items coming and going. And Lisa, I'm not sure if you heard more during your meetings with different departments of potential items coming before the end of the year.
I think the only ones that I'm aware of would impact, that they're being considered right now and would impact target for next year. So not contingent fund requests, but more target for 2022. So no.
Yeah, and we did get rollover information out, so I think you'll see those. There are some here in your packet I saw, but there are some rollover requests for this year as well.
So
That's not out of contingent fund.
yeah, that's what I was gonna say. That doesn't come out of general fund or contingent fund, does it?
No, it's already set aside in the general fund. There's an allocation line already for rollover balance.
Okay, thank you. It's always a source of real confusion to me. I would hope too, I guess this is for Lisa and Daniel, that when we get requests, OTR requests, that we're encouraging departments to have ample rollover, to use rollover under the circumstances. So yeah, I appreciate that. Any other questions for Drew? Well, Drew, wish Rick good luck tomorrow with his emergency dental surgery. All right, thank you. I don't have much of a chair report today. One thing that we do need to take care of is the scheduling of our September and October meetings. I sent you all an email this morning. Do people have preferences for time? Kathy, do you have any conflicts for those dates that I sent? The September 15th and October 6th.
September 15th, Yom Kippur begins. That's the only comment I was gonna make.
That's we did at night. It's Sunday.
Yeah, that, we did that sunset, so as long as we get Martha home, we're okay. All right, does anybody else have any preferences as to time? I know that Mike and Rich both have other jobs, so.
Now, my only,
All right,
Deborah, my only other comment is, there have been some years where we've canceled budget meetings for September and October because of the expanded budget meetings, and if there was any action needed, the committee would meet briefly prior to either a legislature meeting or an EBC meeting.
oh, well, that's actually quite a nice suggestion, Kathy. What does everybody think? If we don't need to have a meeting, we just won't have a meeting. And if we need one, it'll be special.
And then if you needed one on September 15th, I would ask for the afternoon because I may stay over.
Right.
Okay.
I'm gonna write down for calendar, so I know. All right, well, thanks. So the only other
So
thing
you want to cancel the 13th?
yeah, 13th is gonna be canceled, yeah. And so will the October, well, the October happen anyway, October 11th, because that's holiday. All right, great. Okay, so the one thing I did want to comment on is that I know, and I think this is not private information, I know that some of our employees are concerned that we're posting for a county administrator at a substantial increase in salary. And I know that the perception is that, in all fairness, we should consider increases in salary for the rest of our staff. And I am sympathetic to that. I would stress that I think that the county administrator position and a few of our higher level administrative positions are different in that they require a lot more time and to make oneself available 24/7, 365. So that is a special circumstances, but on the other hand, I want to reassure our workforce that we understand that without our staff, we're dead in the water. We can't do anything. We understand that it's been a long time since we've reviewed their compensation and our compensation structure. And Ruby has advised me that she wants to move forward with getting that compensation study process started before the end of this year. So we will be moving forward with that. And it is my intention, at least, that we will implement recommendations that come as a result of that study. So that's just for general public consumption. Mike, you had your hand up.
What would be the process to approve going forward with the compensation study?
Well, I assume it will come to this committee and we'll hammer that out.
So there would be
Your microphone,
consultant.
your mic.
Oh, I'm sorry. There would be like a
Yeah, Ruby will bring us.
hire a consultant, or what are we thinking of doing?
I would suspect we're going to hire a consultant. I don't think we have the onboard capacity to do that ourselves.
All right, so I just want to, I know we have that as a goal, that's fine. I just want to know how we're going to lay it out.
Yes, that's how it would proceed. I mean, this is all new to me, so I guess I should be deferring to Lisa and Ruby, but that's my understanding. Martha?
So I understand we're in the middle of white collar negotiations, right?
We have a tentative agreement with White Collar.
Okay, does that mean it's in the process of being voted on?
Yes, it's being considered and voted on.
Does this confuse that?
Compensation study, no, I think they're two separate events.
Thank you.
Okay, thanks. And then the other thing I wanted to mention is that we will be having an executive session today to discuss a personal matter involving a named employee. So that's all I've got. Henry has advised me that WDIC has not met since our last PCP meeting. Henry is online if we have any questions for him. But otherwise, I don't think he has a report. And that gets us down to Ruby. Hi, Ruby. Oh, wait, Henry has unmuted himself. Have you got something, Henry?
No.
Okay, thanks. Nice to see you, though.
Okay.
Okay, Ruby.
Okay, hello, everybody. Just a quick update on our searches, and I will send this via email to everyone, but it's just a continuation of the search update that we did on the last meeting. Our completed searches: Chief Sustainability Officer, Purchasing Manager, Deputy Workforce Development, Director of DOER, Budget Director, and Budget Analyst. The searches that are underway or pending: we have the Project Director and the Data Analyst for the Community Justice Center. Those were posted July 15th until August 15th. The Airport Director will be posting Wednesday, August the 11th for a period of 30 days. County Administrator is in progress. The contract has been executed with Pinnacle, and they are drafting the recruitment brochure and the postings. County Attorney is on hold pending further discussion regarding possible internal promotion. And then we've done 2 per diem positions for county community health nurse and registered professional nurse to help with the uptick in COVID cases. And in addition, there are additional 13 county vacancies that are in the application process and 34 in the continuous recruitment process. And if you have any specific questions about those, then you can contact me and I'll respond accordingly. As far as the compensation study, we've done some comparisons with what was done for the city and other counties. And I've requested an RFP template, because for that amount, it has to go through the request for proposal process. And that's where we are with that. Any questions?
What have you been doing? What
I
have you
can-
been doing?
I can barely hear you.
Have you just been sitting around?
I can barely hear you, Deborah.
Never mind.
Okay.
Okay, Mike and then Martha.
Yeah, county attorney, here we are in the same place we were last month.
Right.
Who's hearing this and why aren't we advertising this?
Well,
Go ahead, Ruby.
there was discussion, there was an internal candidate. There was a discussion about promotion from within without the search. I haven't received any further directions from that.
Discussion with whom?
With the chair of the legislature, with the chair of budget, capital and personnel, and the vice chair. If you will remember in a previous legislative meeting, the legislature gave them approval to talk with me about searches, upcoming searches. And that was from one of those meetings.
Well, Ruby, this isn't directed to you, this is directed at the legislature. And that is, I think it's time that we advertise this position.
I appreciate that, Mike, and as you might understand, Leslie hasn't really been in a position to address this issue with me, and I'm not going to move forward on my own initiative.
Leslin is the chair of the legislature, but it's the legislature that hires this position.
Okay, Martha?
Yeah, I would agree. This has not been brought to this committee in any formal way. I would like to do that. And if that means make a motion right now to say, let's initiate the search, even if you have an internal candidate, we have forever had a full search. I mean, I can think of a handful of department heads right now who were promoted from within, but we went through a search for them all. So I'm not sure what's holding this up, and I'm not really in favor of any further delay. I think this and the administrator are the two of the four most important decisions this legislature makes. I'd like us to get going.
All right, Rich, you know.
I did. I agree a full search would be good to undertake. However, it does seem like we have several searches underway right now. I think there's an alternative. I'm wondering if we could talk about this in executive session, because I'd like to say something about a particular employee.
All right, we can do that, and unless there's some appetite for passing a motion, a verbal motion in this meeting to move forward with an open search. Is that what you want to do, Martha?
That's our standard practice. We have a position open and we write up a job description, we review the job description, we have a search committee, and we have a full consideration of all comers. So I would, if a motion makes sense, I mean, and it's not to say that the internal candidate shouldn't apply. Obviously, that person is welcome to apply. I don't know why that would be different from all the others I'm thinking of that where we've done it that way. So, yeah, this is an action of the full body. What would we need to do here? I mean, do you want a motion?
Rich, did you want to address that?
Well, I'd still like to have a discussion, and I feel uncomfortable having it outside of executive session. Is it possible to have that discussion and then come back in? I hate that.
Yeah, we can, I think we can move forward, tack this on the end of the executive session that we already have scheduled. And then if an action is appropriate and agreed upon, we can come back into session. All right.
Thank you.
Okay, then. So now, Ruby, is there anything else?
Not for me.
Okay, thank you.
Thank you.
All right, so let's take up the vaccination mandate resolution, please. Kathy, is this the format in which it was passed out of GL?
Yes, it is.
Okay, thank you.
I'm going to call Dr. Clayton.
Okay. While Kathy's doing that, let me take your temperature on an idea about separating the mandate itself from the portion of the resolution that would appropriate monies from contingent fund to be transferred to the public health department budget to support additional testing. As I understand the situation, and I'm sure Lisa will correct me if I'm wrong, we don't know exactly how many people we're going to have to vaccinate after everything's said and done, and therefore we have no idea what it's going to cost. It would seem to me that after we mandate vaccination and we know how many people have elected not to comply with the vaccine mandate in favor of weekly testing, we will have a better understanding of what the cost is, at which point we can appropriate the funds. How does everyone feel about that?
I'm confused at what you want to do. You want to take out that last resolve?
Yes.
Sure.
Anyone else? Okay, Glenn?
Yes.
All right, so, I guess, Kathy, procedurally, can we just strike that from this printed motion and a resolution, move it? Or do we have to do this and then amend it?
Probably moving this version and then amending it could be accepted as friendly.
Okay, would somebody like to move this then? Rich moves it, Martha seconds. And then I guess I would like to suggest an amendment that we remove the last result.
I would consider that friendly.
Martha's shaking her head. Yes, okay. So what we have is this resolution without the last result. Any discussion?
So are we saying that we will not pay for this?
No, we're not saying that. I mean, that's,
Okay.
that, we can debate that all day. But what we're saying is we don't know what it's going to cost. So we'll have to, once we know how many employees elect to be tested rather than get vaccinated, we'll have a better idea. Martha?
It might make sense though to have something in here about that the county will pay for that. So I'm looking at the first resolve, let's see. The third line, so for those who will not be vaccinated, undergo testing on periodic basis
At county
at
expense.
county expense.
Okay, is that friendly? Okay. So,
And if I were to say, I think where did I see it? If the emergency declaration at the federal level is continued past September 21st, which I'm gonna guess it might be.
yeah, if things get
Yeah,
there.
FEMA will still pay for testing, is that right, Lisa?
Yes, all we know right now is that it's set to expire after that point, but, so they would need to act, but.
Okay, so right now FEMA's paying for testing and assuming that happens.
Deborah, who would second that motion?
Rich
Rich moved it.
moved it, Martha
Is
seconded
that
it.
from-
No, it was, which was friendly.
At county expense.
At county expense.
Yes, no, that's right.
Mike said it was.
So this is a friendly.
Remember, Amanda?
No, the rules, the rules are.
Friendly, everybody agreed.
Yep.
Okay, so we're gonna have to vote on the amendment. Mike?
reason I'm not in favor of it is because of what was discussed at GO. And at GO, we talked about various possibilities for how it's paid for. When we pull this out, I think that's something we need to continue discussion. Automatic. Paying people.
Rich?
I would love it if we didn't have to pay for it. I thought that wasn't really an option with the union contracts that are in place right now. What would be the option, Mike, if there is
I
one?
was looking to talk to the unions about it.
Well, my recollection of what was said at GO was that changing, requiring the employee to pay for the testing or changing where the employee could sit or, having work from home, et cetera, would be a change in conditions of employment such that we could not unilaterally take that action. Because I'm with you.
I'm not disagreeing with that. I also remember your comment said, you mean we can't have an MOU with the unions?
Lisa, I think probably this is where you and or Ruby should weigh in.
So it was, and Ruby and Amy, feel free to jump in. We came up with this proposal on the advice of Labor Council and making it parallel with the proposal that is currently underway with the New York State employees. So their advice was that changing the terms and conditions of employment by mandating that employees either be tested or have to pay, or sorry, either be vaccinated or have to pay for a test would be changing those terms and we would likely face an injunction. It doesn't, they're not saying that we couldn't go and.
Not disagreeing. Oh. I'm saying that we don't want to foreclose ourselves here by adding this language to market that's suggested.
I see your point, Mike. Just leave it unresolved until we have time to try to work something out with the union. I think that's what you're proposing. Okay. So what do y'all think about that, Martha?
Yeah. It seems maybe we could force employees to pay for it somehow. I don't know, maybe. As frustrated as I am with people who aren't getting vaccinated, I will save my judgment about that and say that, look, the most important thing is to get as many people vaccinated as possible, and failing that, to get them tested regularly. And if we can get that done without creating animosity and resentment unnecessarily, then that would be a goal. So I worry that the people who are not vaccinated yet probably have a reason that they're not, and this whole policy is going to be hard for them to swallow. I think if we try to stick the bill to them as well, that will feel punitive. And especially because it's probably going to be reimbursed by FEMA anyway, I would really rather put that in here as a commitment. In fact, yes, as a commitment to say that we'll cover it. As we have done all along, try to reach out to improve acceptance of these measures. And I think the money is something that we could just take responsibility for.
Yeah, I agree with you, Martha. I think that right now it's a very hard time. We don't know where we're headed. And people are making a decision for one reason or another. Some people have religious reasons. Some people are scared to get the shot, whatever their reason is. And I think to make our employees pay the $100 a week, it's just not sustainable. People are feeling this economically with their partners not working, with no childcare. We really don't need to pass that on to our employees.
Mike?
NGO, we talk about it could be a portion.
Glenn, I haven't heard anything from you.
Well, if you don't put something, it's in our intent to pay for this. It's gonna make about a lot of bad feelings between the workers of Tompkins County and us. I mean, we have to tell them that it's our intent, but we can't do it right now. But to say that, leave it open, they're gonna say, I'm gonna have to pay for it.
Yeah, that's a fair point. Okay, so I guess we need to vote on,
Can I have a motion reread and then the mover and seconder?
Martha, I think this was yours.
Yeah, first result, third line, to be vaccinated, undergo testing on a periodic basis at county expense as recommended, blah, blah, blah.
And then the second,
And then
That motion was,
Who seconds?
There wasn't a second because it was considered friendly.
Yeah, except it's not considered friendly, so we're gonna need a second and we're gonna need a separate vote. I mean, it has to be friendly to everyone this time.
I would second it, but I move. Is that okay, Kathy?
Yes.
yes.
I'm happy with that.
You're friends with yourself, right?
That's the fair.
Okay, so can we get a vote on that?
Deborah.
Deborah,
Yeah,
can I speak on the motion? The
sure.
resolution? Yes, I just think that this is unnecessary, as I sent the email around to everybody saying that there's a carrot or a stick approach. In fact, having them do the funding is also making the stick bigger. I think that we should, in fact, give people a chance, bring the vaccine to the county people and have them have a chance to make a decision if they don't, and then do this later on. That's just my thoughts, but I know that Ann Corman weighed in and said that we should probably get DIA to maybe give out some cards from the employers. I just think it would be a better way to handle this. And Nassau County has more vaccinated people than we do as a percentage. And so I think also what we're talking about, 210 people here, I believe. And so I don't think it's really necessary to do this.
Well, that's duly noted that 200 people is, a quarter of our workforce. And
Yes,
did you have any other?
Yeah, thanks, Deborah, for letting me chime in. And Henry is accurate in what I suggested. I would, I'm not on this committee, but I would personally, I would consider giving a $50 or $100 or more gift certificate to all those who would get vaccinated now. Other counties are doing that, and I would try, as Henry said, more of the carrot approach first, or at least combined.
Hey, Rich?
I understand the impetus for doing that. I hesitate though, because all the county employees that have undertaken to get vaccinated, I believe have behaved responsibly. And they get no bonus for doing it. They were just patriotic.
That's right.
I don't have a lot of appetite for giving a gift to people to finally do what they absolutely should have done a long time ago. I hate to speak harshly, but that's how I feel.
Martha?
Agree with that. I think the reason to affirmatively put these three words in here is important, because by taking out the last resolve about the contingent fund, it signals that, oh, maybe we aren't going to pay for it. When in fact, that wasn't really the reason for deleting that, but that could leave people even more concerned.
Yeah, I don't really love the idea of having to pay for people who have so far refused to do what they should be doing for the benefit of their fellow employees in their community. But I take the point that Martha and Rich and Glenn have been pushing, and Shauna as well. So I will vote for this.
Can I say something else?
Sure.
Yes, we know from Dr. Claypack that the majority of the people who got infected the last week or so were vaccinated. And so we're not testing any of those people. And so in fact, the biggest concern that we should have would be breakthrough infections, and yet we're not doing a thing about that. And so I think that this sort of shows that we're not being effective. We're not, in fact, testing people who already have the vaccine.
Okay, thank you. All right, are we ready to vote on the amendment? All in favor? Okay, that's 4. And opposed? 1. All right, so now we can proceed to the main resolution. Martha?
I have a question. Have we surveyed the sort of 35 or 25% of our employees who, I mean, I know there was an extra push to make sure people did do the attestation, and some still didn't answer. And then there are some who said, no, I'm not vaccinated. Maybe they said, I'm not going to. Have we done any kind of outreach to try to find out why?
Amy could speak to that. I know there's been further outreach. I don't know about why.
We haven't asked the question why, because we've been guided not to ask that question. I will tell you that a lot of the employees who have not attested have provided why. They don't feel that it is anything that they need to provide to the county. So we have had some pushback on that. What that also means from the original proposal I sent, 70% have attested that they are vaccinated. 15% had said that they are not vaccinated. I don't know why they've chosen not to be vaccinated. And then that other 15% hasn't said either way and refuses to fill out that attestation. So we're talking about a percentage that isn't willing to say if they're vaccinated or not. I would assume some of them are. I also don't know that they would still provide that vaccination status, even if it were mandated.
Okay. It's kind of hard to process, but okay. What about specifically, and if this gets into somebody's privacy, like thinking about the corrections officers, for example, and sheriff's deputies, people who are obviously public facing. This is not just like Big Daddy trying to control your life. This is a condition of your employment that you're face to face with people, some cases living with them. What do we know about the sort of public facingness, that's a terrible word, of the people who either aren't or won't tell us? Or maybe flip it the other way. What do we know about our deputies and our corrections officers specifically, and how many of them are vaccinated?
I don't have those numbers right in front of me, Martha, but I think what we could do is look at a departmental breakdown potentially and see what those numbers look like. Lisa, I don't know if you have any more on that.
I think, yeah, I think probably we could look department by department at percentages. I don't know if sharing that information gets into any personally identifiable information or not. So we just have to kind of look at the percentage breakdown.
Well, I guess I would leave it to you guys to figure out like which employees, and even within departments, it's not the whole department, which employees are really critical in that way. And I feel like a real responsibility there to be very sincere about the need that those people get vaccinated, and even taking stronger measures than we are here, and whatever that looks like. You understand my concern, and so just throwing that out there. And you know, nobody has to tell us, just that within HR, within staff, figure out those people who are putting other people most at risk, and it really is a responsibility. And I'll just say, to finish up, Tompkins County is the leader in the county promoting vaccination. I can't get my head around how we're not all as a team, the biggest cheerleaders for vaccination of any entity in Tompkins County. So it's profoundly disappointing to hear that 30% of our employees aren't on the team. I'll just say that, because our public health people, the EOC people, everybody has been struggling through this for a year and a half. We have a wonderful tool. Why aren't our employees on the team?
Because our employees are a cross-section of our community, and our entire community is not on the team. That's just the way it goes, unfortunately. Shauna?
Yeah, I just want to add, I did a ride-along this weekend with one of the deputies, and I am definitely afraid that if we were to mandate the vaccines for everyone, that you would lose some deputies. There are certainly some deputies that are not vaccinated, and there's already a shortage right now. And, just like in healthcare workers, many nursing homes can't mandate it as much as they really need to. I mean, we're all probably speaking to the choir here, but I think, if we mandate, we have to understand the consequences of that. And right now, our sheriff's department cannot afford to lose anyone. Their deputies are already working doubles, and they're working a ton of hours right now.
Let me just say that, there was an article in the New York Times over the weekend, I think, talking about, the pros and cons of these vaccination mandates. And it quoted someone who said, yeah, I don't want to get this shot. I don't feel right about it. I feel like I'm being forced, blah, 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 blah. But if my employer says I have to get this shot, that's not a hill I'm going to die on. I'm not willing to lose my job. I'll get the shot. I know the experience that we've had with my stepson, who finally was told by the lab he works in at Columbia that if he didn't get vaccinated, he was out of the program because they couldn't safely have him in the lab. And he got the shot. It's just until people, for some people at least, I know that there are people who will never get the shot no matter what. I know that there are people who can't for health reasons, but there is also a population in there that's wavering. They will voluntarily get the shot, but if they have to, they will. And if we can reach that population, then this is worthwhile. I don't see any advantage trying to slice and dice our workforce into people who have public-facing jobs and people who don't, et cetera, et cetera, et cetera, because I think once you start differentiating between groups of people, you open yourself up for a legal challenge.
Conditions of employment are very different, particularly corrections.
Well, it's just my feel. Every time you treat people differently, you face a challenge. So, anything more? So are we ready to vote? All right, all in favor of the resolution as amended? That's unanimous, thank you. And I'm sure that we will have this conversation yet a third time. A week from Tuesday. So now, moving forward to Lisa's resolutions. I guess some of these are Greg's resolutions. Greg Potter, come on down.
Okay, it looks like the first one up is the resolution regarding the HR, Human Resources and Payroll Mitigation or Migration Project. So we'll start there.
That's the revised one that was handed out. ID number 10295.
And the only difference on the original that was submitted and the one that was revised is some of the account numbers at the bottom of the resolution.
All right, can I get a motion? Martha moves, Glenn seconds. Now Kathy again. Which one are they moving? The one in the agenda packet or the revised one?
No, the revised one that was distributed.
Okay, thank you. All right.
Okay. So bear with me in my explanation of this because it's kind of messy, but hopefully I'll get around to the point of this eventually. So we are in the process of migrating from our current payroll system, which is called Infor, to a system that collectively manages much of what we do across the organization, to a company called UKG, which used to be called Kronos. So there was previously a capital project to move it, to implement it, but we didn't meet the deadline for the implementation of that project for a number of reasons, some of which is related to the pandemic. And that resulted in more expenses from the county to go live with a couple pieces because of the employment of one of the ITS employees that has recently retired, but came back to work to help us. And we didn't budget for the salary fringes based on the expected go live of the application. And in addition to that, we had to continue to pay the current company Infor the service and maintenance costs for keeping their software up and running at the same time as paying UKG for their software as a subscription model. So the intent was that we would be live before the end of 2020, but that has bled into 2021. And therefore we have overages in the project for both salary and fringes for the employee and the additional cost for the subscription of the software. There are 5 modules in moving to UKG that are part of the project. So we'll quickly talk about what those are and understand the difference where we are now and where we're going as an entirety. So the first one is Telestaff, which is a software that's used exclusively by the Sheriff's Department for the management of their shifts and their employees electronically. So they used to do everything on paper. That has been completely implemented and has been successful. So all the information from them feeds into the payroll system electronically. So we no longer have to do the data entry for every timesheet for every employee in the Sheriff's Department for every pay period. So that is done. The second piece is the replacement of the electronic time system that we used to have, which is TimeForce, that we paid for the UKG module, which is called Workforce Ready. So that has been implemented across the board, including all the blue collar employees as well. So everybody at this point has been cut over to electronic time cards. How the information gets in there is different for the sheriffs, is different for blue collar because they use electronic time clocks. And anybody outside of that does entry into an interface that is hosted by UKG in the time system. Elected officials are on salary, which is different. So they're automatically included. The pieces that remain to be implemented that we hope to go live for on October 1st would be the HR Human Resources module and the payroll module. The HR module is the one module that manages all the activity for the employees in the system or across the county and has a lot more functionality than anything we've ever had in the past, including employee self-service, tracking of training. It goes on, it's pretty extensive. The payroll system provides for all the calculations of the money that people make in the transaction and does all the balancing of the money from the accounts after we move that information into the financial system. So that's a big deal. There's a lot of money that goes through there. Every penny we spent on salary fringes goes through the system. So keep that in mind. So the last piece is the module that we've invested in is ACA, or Alternatives Care Act piece. So we've invested in that, but we can't go live with that until we go live with HR payroll. So that's the small piece of what we're talking about. It should be pretty quick to turn around. So the first resolution is just the one-time money to help us to pay for those two additional expenses that weren't anticipated for 2021. We had to use another ITS capital account in the meantime during the pandemic to pay for the bill. So we have to reimburse that capital account because without that money, we can't proceed with another infrastructure improvement project we have planned for this year. That's one piece of it. So the bottom line is that we're looking at an overage or expense of about $217,000 and $217,866 for the reimbursement for this. In addition, the difference, there's a difference of about $39,950 between what we pay now for all of our systems and what we're moving to in UKG that we expected, and that has been submitted as an OTR operational expense annually for us in the future, and that's already submitted under the ITS budget. That will eventually be distributed or doing some fiscal target adjustments after that to HR and finance from ITS. But we'll talk about it later.
So I guess the main question I had after reading the memo is that ongoing OTR piece. Why is that going to be an ongoing OTR and not a target?
Well, it will be an ongoing ongoing OTR as targeted. So it's not one.
Oh, so it's basically a target increase.
Right, you got it.
Okay. Thanks. Any other questions for Greg? Martha?
We should have puppets.
Or diagram. You should get an animated diagram.
No, when I read the resolution, I was like, I was so grateful there was a memo. So thank you.
Sure.
Even so was hard, but great. Thank you.
Any other questions? We ready to vote on this one? All in favor? Right?
Yes.
Okay, that's unanimous. Thank you. Okay, and then you've got another one.
I do.
I hope this one's easier to explain.
I think you'll understand this one.
All right, is this one an amended one also, Kathy, or is it the way it is in the text?
That's the way it is.
Okay, great.
Would you like me to start? Okay. So this is all about the need to increase our bandwidth in and out of the county as a result of some recent problems we've had with bandwidth capacity, more than likely the result of everyone coming back to the office and continuing to use virtual meeting streaming as part of their daily activities. When they were remote, the bandwidth was really at whatever location they had to Zoom or Teams or whatever virtual meeting system they had. Since they moved back on site, they're doing this from the county PCs in a county building, and we have to manage all the bandwidth coming and going. So the increase in bandwidth, we've seen a substantial problem, particularly in the mental health area, for virtual sessions that they have with their clients, and maintaining the reliability of the network to provide that service. So this is going to be an increase of 2 contracts for internet service providers, one with First Light and one with Spectrum, to increase the bandwidth. And the third piece of the puzzle is that we have to invest in another upgrade of a load balancing piece of equipment, which manages the traffic between those 2 ISPs. So if one fails, the other one automatically picks up. So we've had that in place for over 10 years. But we have to invest in more capacity for that piece of equipment or the device to better manage the traffic that we're seeing coming across the network. So this request is a one-time request to get us through the incremental difference for the cost for this next 6 months. And then we have to submit an additional OTR as part of our 22 budget to cover a 12-month difference that we didn't initially submit as part of our budget process.
Okay, but eventually won't that be target as well?
Yes, that will be target as well. So we'll submit another request for target OTR in the 22 budget process in coordination with the budget process.
Okay, great. Any questions for Greg? Ready to go.
Can we get a motion on this resolution?
Okay, Martha needs 1 second. Ready to go? All in favor? Great. Thank you, Brad.
Thank you. Can I bend your ear for one more minute?
I suppose.
I'm gonna put in a plug for those of you that are attending NISAC in Syracuse. There's a couple of workshops that are scheduled that deal with cybersecurity at the county level that are really important. One of those is being presented and being held by somebody that we work closely with, and that's understanding your county cybersecurity readiness. So if you are attending NISAC, it's a really good idea. The NISAC conference, understanding your county's cybersecurity readiness. So that's an important one. And then the other one is safeguarding county information systems, data, and services. And these things are really important in the current environment of remote workforce and supporting them. And having an advocate or understanding, a better understanding of the elected official side is really part of this structure. I think that's what they're trying to do. And myself or Lauren would be happy to attend those sessions in conjunction with anybody from the legislative board that wants to attend and to coordinate that as well. So we'd be happy to sit through and explain what circumstances are in Tompkins County based on what those are items that present. So anyway.
Do you happen to know what times they are?
The first one, understanding your county cybersecurity readiness, is being held on Tuesday, 9/14, from 10:45 to 12. The second one is 9/14, from 2 to 3:15. That's safeguarding county information systems.
Hey. Thank you, Greg. Lisa. The next one is yours.
Resolution authorizing use of ARP funds for compliance and reporting.
And this one's revised as well. So can I get a motion on the revised resolution, please? Greg, Glenn moves. Second. Okay, Lisa, take it away.
So this position was authorized during the last expanded budget committee meeting, but for it was not authorized. So this establishes funding for it. At last week's GO committee meeting, the additions were passed as part of this resolution.
Any questions, Martha?
So totally support the additions here from the committee. Can I ask, so this is for the rest of 2022, this 37,000?
Rest of 2021.
That's right. It's not 2021. So for a full year, it's about 3 of that.
This was, as I recall, when we were putting it together, this was from August to the end of the year. So.
Okay, great. Thank you. So in the, I guess in our ARPA accounting, then the year's worth. Got it. Okay. Thank you very much.
I guess just a footnote to this, and this gets right down to the personnel level, but we had 2 candidates for budget analyst position. One of them accepted the position. So I'm not certain to what extent or, when we were going to hire to start utilizing these funds. It's probably going to be a bit later anticipated.
So this is not Samantha Freeland?
No, we already approved her. We already approved one. Yes, we have approved one.
That we did a couple months ago.
Yes. This is the second position that we talked about.
Because remember, we were going to, with Kevin's departure, we were going to hire Daniel and then get him one budget analyst.
And that's Samantha.
Yes.
So you're saying now this is another person. Okay. And did you say you may have that person? That's what you're saying.
We do not, we completed the search process. We had 2 finalists, one of whom is now in court, Samantha. So we're going to have to reopen a search.
Got it. Okay, thank you.
Okay, are we ready to vote? All in favor? That's unanimous. Thank you. All right, Jay, you're up. Hi.
Hello, how is everyone today?
We're all in our places with bright shining faces.
We're spending too much money.
Sounds good. We can continue the trend here.
Maybe that, yeah. We're at a roll, might as well take your shot.
Well, I have a resolution here which would adjust the 2021 budget and the 2022 target, which would allow my office to continue with our annual equity maintenance program. Last year, we had lost 5 positions, 3 to retirements, 2 transfers to other departments. With the rise in the real estate market that I'm sure you are all aware of, you know, we're seeing repeat sales from last year that are 20% higher with no physical change. We just simply can't do the work that we need to do in order to continue our annual equity maintenance program. But this resolution will allow me to hire 2 assistant real property appraisers and a data collector, which would allow us enough time to get them trained in order for us to have them ready to go by the time we send out assessment change notices next February or March, and be able to deal with the 4,000 or 5,000 people that'll come back and contest those increases.
All right, can I get a motion on this? Glenn moves, Rich second. Thank you. Jay, can you ballpark what the increase in your department's target is going to be in the coming years for these positions?
Yeah, it's all told, it's about a $260,000 increase in the target, which is about $100,000 more than what our 2020 target was. So it looks better in my eyes if you look at the increase over the 2020 target, which restores that 12.5% decrease as well.
Okay. All right, any comments? Mike and then Martha.
Jay, if you could just remind me, quite a number of years ago, the state used to give us, what, $350,000 a year toward the, I think the annual assessment that we were doing. I think that went away. Are we getting any money from them now?
No, we get nothing from them. And it was $5 per parcel that we used to get. So it was about 150,000, give or take some change. They do have a 3-year program, which you can get up to $5 per parcel if you measure the 2 sides of a building. Buildings don't grow without building permits. I don't know why you'd want to measure them. Or you can get a new flyover and measure from that. But anytime I looked at that, the cost of trying to comply with that new system far exceeds any reimbursement we would get. And because you never know how much you're going to get, you could get as low as $2, which would be 70,000, or we could get as high as $5 at 165,000. At either amount, it's still not worth the no benefit that we would get by trying to comply with the state's new state aid program that we lost. Had to have been 15 years ago, because I think Valeria was still director at that time.
05.
Yeah, time flies when we're having fun.
I was thinking it was more money, but thanks for correcting that.
Okay, Martha.
Jay, I'm a little confused. On the line 9 in the resolution, it says the department has the need to fill the positions for 2 assistant real property appraisers but then on the expenditure side, you've got one.
Yeah, the line 21, that is actually the amount of money for 2 positions for the 3 months.
Okay.
So
we
that's,
just need to add an S.
I think that's just the title for that account number.
Oh, okay.
but there is an adjustment on line 26 where it's 3 positions.
Right, that was,
Three,
Okay.
three people within 2 positions. So I think a 3 there would be good. And I think that was how Geo passed it.
That's correct.
okay, that makes a lot of sense. Yeah, I would, this, as Mike said, this feels like we're spending a lot of money. I sort of big picture, we eliminated 47 positions last year. So we're starting to see a couple here and one there and a couple there that we're having to add back. And I mean, I think this is not a surprise. And I think we're a long way from 47. So I don't, you know, it's always a little, makes you a little nervous, but it just the big picture is that we kind of knew we were going to be in this position. And during the budget retreat in April, the legislature made a decision to kind of keep the target increase low and expect to see more OTRs, make sure big picture. And rather than kind of say, okay, well, how many positions do we think we might add back, and let's build that into our target. Instead, the legislature decided to stay on the low side. So we would be looking at each of these one at a time. So I just want to kind of give some reassurance to anybody out there who's listening that this is not crazy. We kind of knew this is going to be the position we'd be in. So thanks for bringing this to us, Jay. It's really, really, really important that your department does the work that it does. You're recognized around the state, and we even hear from like the commercial people who pay a lot of the taxes that they really appreciate the professionalism and the responsiveness of your office. And it takes people to do that. So thank you.
Thank you.
We should do the decennial reassessment. I was trying to remember how many positions we added from one of those. Seems like around 10.
In 2000, when we did the last decennial, if that's the way you pronounce that word, we actually had 19 and a half individuals. That was when I was hired. So 19 and a half is a little too much. You know, if I had my way, I'd kind of stabilize in the 14, 15 range. But in years past, we were able to accomplish things because of the people that we had, not necessarily the positions that they were in. When you take someone like Al Fiorelli, who's served in every position in my office, every director's hired him, he just keeps coming back, the wealth of knowledge, you can't replace that with a brand new assistant real property appraiser. So that's where we need a little more people than the people that we've had.
Couldn't agree more.
All right. Are we ready to vote on this? All in favor? Okay, Jay.
Thank you. Have a good day, all.
You too. Okay, so we have somebody from emergency response to speak to the next resolution.
I saw previously that Michael Stigley was on, but I'm not sure he may have had to.
Yeah, I saw it too. Can someone else speak to this?
I can speak to it, sure. So this is an extension of the Assistant Director of Emergency Response position, one time through the end of the year at 0.5 FTE. And this is essentially for the project management of the for the completion of the backup 911 center, which is moving along, but has experienced delays due to COVID and the shutdown in the spring. We're partnering with Cornell on it. They were shut down for a period of time as well. So it's led to unanticipated delays.
Is it going to be finished by the end of the year?
It is, they are going to be needing some continuance into 2022, but probably are looking at a different personnel to carry it forward, because the individual who's been doing this has been tracked to retire for a long time and would like to do so. So
Another Kathy Slaughter and CBO Hall. Okay. All right, can we get a motion on this one? Rich moves it, Martha seconds. Any discussion? Rich?
I should say this came before public safety as well, so we had a discussion there. And putting this in place would allow the Department of Emergency Response to also address some functional issues they've had with their operations, which are pretty important. They've been understaffed for some time. And like many departments, like we just heard about from assessment, there's some lagging indicators that they really need this.
Okay, thank you. Martha?
I'm not clear, is there gonna be a target amount going forward, or is that different position?
there's going to be, it's going to appear in their 2022 budget request as another OTR.
For a full-time or half-time?
Half-time.
Okay, thank you.
And that'll be temporary until the build out's done.
Right.
Okay, are we ready to vote? All in favor? It's unanimous. All right. Next. This is that. The rollover. Yeah. Government operations. Is someone from government operations who can explain this, or is there someone from staff who can? I can take this one as well. Okay, thank you.
So this is, per our fiscal policies and the rollover policy, that departmental use of rollover in the current year is reviewed by the legislature and by the program committees. So in this case, the departments reporting to government operations were compiled, and their rollover requests were listed. And the forms listing how they received the rollover, the unspent funds, et cetera, was reviewed by government operations, and this was passed on to budget capital personnel.
Okay, any questions? Martha?
Yeah, we didn't get pages for the attorney in the legislature. I see they're small amounts of money, but maybe not complicated, but is that, wasn't my packet, it's not on my paper.
Okay.
But, you know, I got a few blank pages. But I'll be happy to move the whole thing, and it looks like packet pages 36, 7, and 8 are blank. So I have to do for things. Do other people have something? Anyway, I'll move the whole motion.
Okay. Yes. Do we have a motion in a second?
No, not yet.
Okay, so we need a second. Rich, so thank you. It's nice to see our departments using roll. So, thank you. Any other comments?
Yeah, and I appreciate the way the forms read and the way, when you get a sense of, oh, how come you have this extra money left over and what the plan is. I mean, I think this is a useful process.
Okay, anybody else?
There was a revised one handed out as well, this resolution. It just removes the action that was already taken by the legislature.
Oh, okay.
The use of rollover earlier this year.
So can we now?
Of course.
Of course. Who seconded? Rich, did you second it? Yes. Okay. So, all right, are we ready to vote on this? All in favor? Okay, so now we're down to the last one, which is as it appears in the agenda. Can I get a motion on that one? Budget adjustment and appropriations for departments that report to BCP. Glenn moves, Mike seconds. Any discussion or questions? All right, are you ready to vote? All in favor? That is unanimous. All right, then, I will accept a motion to go into executive session to discuss personnel matters involving named employees. Moved by Rich. Seconded by Martha. Okay, let's give everyone,
Can you vote on that?
oh yeah, all in favor.
So you're not going to come back out and take action?
We may, I don't know.
I think I'll end the stream for YouTube.
Okay.
And probably stop the recording.
Okay.
Pause the recording, Kathy. You could pause it and then you could start the recording again. Or if they come out to take something, and we could re-upload a different video if need be.
Okay, to YouTube. Okay,
Yeah.
Thank you.
Thanks, Dominic.
Of course.
You don't need me to stay. You don't need me to stay, do you?
No, I don't think so.